Well, thank you. Once again, I'm Nick von Bergen, and I get to talk about non-invasive blood pressure monitoring for the electrophysiology lab. So I have no disclosures related to this talk. So when I think about blood pressure monitoring in the lab, I think about two things. One, the typical blood pressure monitoring with the cuff and or invasive continuous monitoring with the arterial line. Unfortunately, to get the invasive continuous monitoring, there are risks. So complication risks has been estimated between 1 and 3% with things like hematomas or more concerning things like retroperitoneal bleeds. And there's also risk factors associated with these complications such as anticoagulation, larger arterial sheaths, and or large BMI. So can we have the best of every world? Can we have accurate continuous monitoring, but without the risk of vascular complications? Well, there's two main ways we can do this. So there's arterial applanation tonometry. This is essentially taking a tonometer or a pressure sensor and pushing against the artery to see what that back pressure happens to be, to estimate what the pressure of the artery is and the blood pressure. And there's the volume clamp techniques, which I'll discuss the technique a little bit more, but it uses, this is actually a finger here with a cuff and a light source that can then estimate what the arterial waveform happens to be. There's a few companies that have products that do this volume clamp technique. ClearSight is used in the adult UW adult lab, and I actually have the Phenometer in my pediatrics lab. There's also CNAP HD and T-Line, other things that have a similar technology for evaluating the non-invasive blood pressure. So how does it work? So the volume clamp method, it actually has the inflatable bladder, a light source that measures the arterial diameter and the detector. And by inflating the bladder and then trying to keep the artery size the same, you can then estimate what the arterial pressure happens to be. Every once in a while, it's physiologically or periodically recalibrated just to make sure it continues to be accurate depending on the arterial size and the pressure in the bladder. And then there's a little bit of math and assessment of the kind of alteration in height between the brachial and the finger that allows you to have a finger blood pressure estimated at the brachial blood pressure. So is there data to support the use of non-invasive finger blood pressure monitoring? If we first look at accuracy, here's just an example during an atrial fibrillation study, looking at what's the correlation between the ClearSight in this case and or the invasive blood pressure. And in general, the correlation was reasonably good. However, notice that every once in a while, there's some pretty good outliers here. You can see here is 150 millimeters of mercury by invasive blood pressure testing, and it's a little bit less than 100 by non-invasive. This is for systolic pressure. If you look at the same data in a different format, this is a meta-analysis of multiple studies that were through many disease states, not just the cath lab. What they found is in general, there's a reasonable correlation, about a 5 or I guess 4.2 or so mean difference between the means, and it was somewhat similar between the systolic and diastolic pressure, but there was a fairly good range. So I would summarize it as, it's reasonable but not perfect correlation with the arterial line, but in my clinical use, I thought it tracked the trends fairly well. So here's this is the Acumen IQ in use in one of our adult labs. This is the arterial waveform. Here's the Acumen IQ. You can see really it's pretty close correlation here between the two, arterial waveform and the Acumen IQ. And here's the recalibration. If we try another one here, here's once again a arterial waveform, and then also the Acumen IQ right there. This is during a cardioversion, atrial fibrillation converted to sinus, and really the correlation was pretty good, a few millimeters of mercury off, but in this case 7 and 3 between systolic and diastolic, and the trends were really fairly good. So I would once again say we have good but not perfect correlation of accuracy, but there may be other benefits as well. Less time for arterial access. Of course, if you don't need arterial access, less risk for complications. It's definitely more accurate blood pressure than not monitoring. So if we think we're doing every 3 to 5 minutes of blood pressure monitoring with a blood pressure cuff, if we can get it continuously evaluated, that's a definitive advantage. And in my clinical experience, I would say that with the adult lab, the Acumen IQ appeared to correlate well enough with the arterial line. The Phenometer in my lab was very similar, though every once in a while when the blood pressure would drop with rapid SVT, the device would think that it wasn't picking up and would error, have to be reset. But for me, it was an appropriate replacement for patients who I want an arterial pressure without an arterial line. So what about guidelines? Are there things that say we should or should not adopt it? Well, there's not any guidelines that say we should adopt non-invasive blood pressure monitoring. the guidelines actually say how accurate should you be to be a nice replacement for the current invasive monitoring. And it says, hey, well, we probably should have less than 5 millimeters of mercury correlation for systolic, mean, and diastolic pressures. The blood pressure monitors are occasionally within that, but occasionally they are outside of that range too. So they don't quite fit the AAMI standards, but at the same time, I don't know if that matters for our particular patients. We oftentimes need a trend and a kind of reasonable estimate as opposed to an extremely accurate blood pressure measurement. So if we do the tech assessment summary, as we think about, do you adopt this in your lab or not? Once again, we've discussed the clinical advantages of a continuous and real-time non-invasive blood pressure monitor. The reason I actually adopted it at the University of Wisconsin Peds lab because of more of a philosophy. I wanted to be less invasive, but then also have nice high safety. And so I occasionally use in my patients the phenometer. If we look at the cost or the expenses to the hospital, well, of course, the device itself costs. There's the phenometer, which you could buy the large device itself, or the things like the Acumen, which has disposables that are cleared for single use only. There's also some nursing and staff education. But on the flip side of that, there's the potential effect on less time for access and or decreasing complications that could be potentially a cost saving for the use of these non-invasive blood pressure monitoring systems. Well, I'd be happy to answer any questions if you do have them, and thank you for your time.